each time one bell, you know.
Right. So
okay.
all these things are hiding somewhere behind the Zoom, so we have to find it. So we've learned it the hard way that you could. Now that sound won't come. And I'm not. The participants can unmute themselves, but we did 2 webinars and it was quite a matured audience. They were quite nice, so we did not have any issues, and it went pretty well. You can still see the screen shared, right?
Yeah. Yes.
Right.
It is not in the. It's in not in the presentation mode yet.
Okay. I'll do it later after the initial. We'll wait for a couple of minutes, then we will start. I had to mute some of you as some noise was coming, but if you think you need to speak, please unmute yourself. Those who have joined, thank you very much. We will give it a minute and then we'll start. I think we have enough people. I think in the interest of time, we should get this started.
Yeah.
Right. You can see people slowly trickling in. I don't want them to miss the initial introduction.
Maybe one more minute. I
Minute
think.
and then we'll
Yeah,
Yeah.
give
Then
minute.
we'll start. Yes.
Yeah.
People are getting in.
Right. Yeah, so let's get started now. It's almost 5:45. So first thing first, good afternoon and warm welcome to this webinar on MPH, that's Master of Public Health. My name is Rajgopal and I head the outreach team here at Azim Premji University. Of course, speaking to you from Bangalore, but for today we shift the focus to Bhopal. Right, that is where the MPH program will be offered at Azim Premji University, Bhopal. I was discussing with my colleague this morning. This is a long-awaited session for us, right? As we were planning this for quite some time. But I can tell you that the timing today is probably the best, as we have, some concrete things to share. So what I'll do is in the first 2 minutes or so, 3 minutes or so, I can see people joining. I'll quickly explain how the session is structured. Right? So after my brief intro now, our faculty members will be teaching MPH, they'll be interacting with you. So that's going to be the first part. So when we say reimagining public health in India, what do we mean here? We want to give you some insights into the status of public health in today's India, how we have designed the program to address those challenges and concerns, the learning ethos of Azim Premji University, which you'll see is quite different from other universities. I wouldn't say unique, I'll say it's pretty unusual. So we'll talk about that. And of course, we will talk about future opportunities that awaits you after the degree, right? So that's the first part. The second part, I'll go through in some detail the tentative timelines we're looking at, the selection process, and of course, our need-based scholarship and financial aid scheme for you to study at Azim Premji University. Final part, once this is done, we'll be able to do this in the first 30-40 minutes or so. We'll open it up for Q&A, right? So before we begin, I think I have the honor of introducing my colleagues, my accomplished faculty members, I would say, who have taken the time to interact with the aspirants who have joined, right? So in the order of the alphabet, their names, we have Arima Mishra with us. Arima has been researching and teaching in the areas of public health ethics and health system policies and practices for the last 2 decades. The second faculty member who'd been interacting with you is Edward Premdas Pinto, who's been a public health practitioner. He teaches courses on public health rights and accountability, social interventions in health, as well as, I found this very interesting, as well as legal tools in public health. So that's his forte. Third speaker will be Mukta Gundi, who has been researching on adolescent health, teaches courses on health education and communication, and introduction to epidemiology as well. So, and we will also have Seema Sharma. She has a training in economics and public health, and she teaches courses on perspectives on mental health, sexual and reproductive health rights, right? So that's the lineup of speakers that you have. I'm sure you got to see, the interest of time, I have to confess, I kept the introduction very short, but you should look at their profile page to really appreciate their entire the body of work and the kind of research they do. So without delaying any further, let me hand it over to my colleagues. Over to you, Arima. I didn't give the introduction about the university. I'm sure you will give them where we come in and things like that. I'll bring up the slides for you.
Okay.
Yeah.
Yep. Okay. Thank you, Rajagopal, for setting the context. What we will kind of will take you through is, let's begin with asking ourselves this question, is that why do we need to talk about reimagining public health in India, right? What does this reimagination entail? And what is its significance in the current context, right? And what is its implications and reimagination for what? To do what, right? So we will kind of take you through some of these questions. And as Rajagopal says, 4 of us will kind of do it. And I'll begin with setting the context for this reimagination in the light of where are we today in terms of public health, situation in the country. Rajagopal, can we have the next one? Yeah. We have come a long way. Way back in 1948, when we actually, post-independent India, we were figuring out how should health and healthcare be organized in the country, right? Elaborate structures, you have sub-centers, etc., different kinds of programs. We also had our first national health policy in 1983. Since then till now, where have we reached? What does it look like? Okay. Certainly that we have improved on certain select indicators. And what does it mean? That of course people have tended to live longer, right? We are living longer. That means the life expectancy has increased, and which is not a mean achievement, which is an important human development indicator. So that has happened. If we look at another, again, classic indicator when we talk about human development is if we look at, say, maternal deaths. Of course, where we were, several years back and now, they have declined, even if the rate of decline is slower, and also the decline is uneven, right? So Tamil Nadu has something else to offer than compared to Assam, to Jharkhand, so those kinds of unevenness, not only on this maternal deaths, but many other indicators, that is there. We also have been able to eradicate certain diseases, right? We have been able to put in place, several things in terms of such a large-scale immunization programs. Yet, we have a long, long way to go if we are talking about health for all. Something that not only the global community, but India had committed, in terms of post-independent India, when we were trying to imagine what our kind of, nation building exercise should look like, and how should we imagine, our society, including some of these basics that we are talking about, education, health. We have a long way to go. We are still struggling and living with and confronted with some of the long-standing challenges. Those health challenges are not new, right? And we'll talk about it. Some are re-emerging, right? Some of the infectious diseases are re-emerging, and some are emerging, right? If we just, even in terms of illustrations, right? If we just have got to look around, something that we are familiar, but I think it's just that it helps us to put things together. If we look at the recent data, recent means we are talking about the National Family, Health, Family and Health Survey data, which is NFHS 5-2021. What does it tell us? It tells us that more than 32% of children under the age of 5 are underweight. Malnutrition, specifically undernutrition that we are talking about, continues to persist. And that's of a concern. Despite having different kinds of programs, etc., we still continue to, address this challenge, or living with this challenge rather. While we have, malnutrition and undernutrition, what we say that in India, we actually have a triple burden of kind of health problems. One is we are dealing with undernutrition. At the same time, we are still struggling with our infectious diseases. If you look at even, our tuberculosis program is so old. We have revised, and yet we are talking about multi-drug resistance, right? So we have infectious diseases, but also along with this, what we are actually, and all of us are familiar with this, is a really rapidly rising burden of non-communicable diseases. When we talk about diabetes, hypertension, cancer, mental health, right? And why we're talking about rapidly kind of emerging is that it's, both in urban and rural areas, right? So, and, when we also, along with this, what is the impact that we are talking also, the health impact of environmental degradation that we are talking about, right? Just take the example of air pollution, right? It continues to kill millions of people every year, and India particularly is ranked very highly in terms of its vulnerability to climate change. So climate change is not something that we will talk about, wait for climate change and figure out the impact. It's here already, right? Another thing, again, we are very familiar, and something that continues to concern us is what we call the high out-of-pocket expenditure. Say, for example, we have been actively, as part of our Millennium Development Goals, we are committed, and then Sustainable Development Goals. We are talking about that women need to deliver in the hospitals because we are talking about maternal deaths must be declined, right? Yes, 85% of births are in institutions, and which is a good thing because we are talking about quality, safe delivery. But if you look at in terms of what we actually, the expenditure, even in public institutions, and this is NFH's recent data, they spend on an average 3,000 even in public institutions. And all of us, we are familiar with the fact that if you just compare public institutions and private healthcare facilities, the kinds of difference in terms of cost is very, very high, right? So out-of-pocket expenditure. So that means something is kind of that should bother us in terms of accessing affordable healthcare. While we are stating these kinds of facts, what it is not revealing is that, when you talk about undernutrition, if you're talking about, say, non-communicable diseases, you're talking about infectious diseases, the burden is not equitably distributed, right? In terms of its outcomes, in terms of its access to care, in terms of how do I manage, in terms of access to, preventive factors for, say, NCD or even undernutrition. The burden is not equitably distributed, right? So what is it that for all this, as illustrations that we are talking about health indicators, the poor and several marginal groups actually bear a disproportionate burden of these kinds of health challenges. So what we say and what we are trying to kind of have been grappling with is inequalities in health and healthcare. And something that, COVID-19 pandemic brought to the fore in its quite stark form, right? And something that all of us we witnessed, right? Even in terms of basics of prevention that we spoke about, whether it's sanitation or wearing masks or even, hand washing, right? So social inequalities in health is an important and a critical challenge. And if we are talking about widening and persistent inequalities in health, it means something is wrong in public health. Because if we're talking about public health, public health cannot be producing, such kind of inequalities in health and healthcare, right? So this basically demands that we really kind of need to pause and rethink the way we are doing public health, right? We are actually, learning and doing public health, and that is something that we're going to talk about. What does it mean? What is required? What kind of imagination? If we are talking about addressing some of these, public health challenges, right? Yeah. Rajagopal, next. So what is that reimagination? So as I'm saying is that we need to rethink about public health practice, right? Because, one can ask a series of questions, right? So we have got so many programs, so many schemes, right? And we're still struggling with some of this very evident for which, there is no dearth of evidence saying that nutrition is important for tuberculosis care, right? There is no dearth of evidence saying, access to quality emergency obstetric can really significantly reduce maternal deaths, right? So there is no dearth of evidence, and there are perhaps no dearth of programs. What is it that's going wrong, right? I think this is the time that we really need to talk about that. If we're talking about public health, it's important that we actually reiterate, because this is not something new. Public health as a field is meant to be that, right? Is to bring the public back into public health, right? So somewhere public health has been reduced to, for several reasons, in terms of individual health care, right? So the health for all have been reduced to health for some. So if you have money, you can buy. If you don't have money, you can't buy, right? So that's basically, and it is up to kind of individuals in terms of how do they, arrange budget for health. But that's not public health, right? That's not public health. So when we're talking about bringing the public back into public health, in terms of that means the reclaiming and reiterating the social purpose of public health, right? So public health essentially means that you're talking about population level access, population level strategies. These are organized efforts by whom? And I think one of the critical and the fundamental questions that we need to kind of ask is that when we talk about public health, who is responsible for public health? Are these individuals who are responsible? Is it the state? Is it the market? Who is responsible for public health, right? So when we're talking about public health as opposed to, say, clinical medicine, which is about a particular patient, particular disease, particular kind of treatment, right? When we're talking about population level strategies, in terms of ensuring that not only that people should fall ill and then focusing on care, but public health thrives, and that is the goal of public health, to be able to say that, what are the factors that produce diseases, and it's important to address those causes, right? And that is something that which is kind of, we really need to reclaim that kind of an orientation of public health. When we are talking about organized efforts, it means in terms of laws, in terms of policies, in terms of programs, because this cannot be just ad hoc kind of measures. If we are saying that we need to create conditions that promote and protect people's health, the population health, because if that is in place, obviously what we are seeing that some people simply cannot afford even basic primary level care, right, is something that we should not be witnessing. So it's about asking those fundamental questions. So what are the goals of public health? Right? What are the goals of public health? What are the principles of public health that in the sense we should inform public health practice, right? Because we know that public health is practice kind of field, and it is a multidisciplinary field, right? You have different disciplines contributing to it. But what is it about those disciplines that I need to know? What are the public health tools that I need to know which should inform this kind of practice, right? Also is that we can't be talking about these tools in abstraction. We can't be talking about these frameworks and concepts in abstraction. They must be grounded in the Indian realities, and the Indian realities, it's not one kind of reality that we are talking about, right? If we are talking about the problems of perpetual, every year that we actually witness dengue in most of the metro cities, we are also talking about many, sickle cell anemia as a predominant kind of a disease burden in many of the tribal communities, right? So that kind of a contextual understanding in terms of the priorities, in terms of that it could look different, is something which is very important, because otherwise, if it is not grounded in the Indian realities and contexts, and it's important that one actually understand those contexts, its public health practice will be just, in air in that sense, because it's not about just concepts and theories and frameworks, right? So it's about asking those fundamental questions, understanding the orientation of public health, understanding the role of the state, the role of the society, role of the collective action, is only that can actually set out this journey of transforming the kind of public health scenario that we just have described. I'll hand it over to my colleague Premdas to talk about, so what does an educational response look like in this context, and what are the key considerations that we had in mind if this is our goal, as to what could the program actually look like? Yes, Eddie.
Thanks, Arima, for setting out this, setting this context. So as the social purpose of public health, that is the one that connects the universities, educational ventures. One, the university itself is driven by the social purpose of bringing in more equity in the society and working towards that. Now, while reimagining the whole public health, we believe that education is a strategy to bring about this transformation. So can we have the next slide, please? Yeah, so this social orientation also means that the public health education that is now producing or giving rise to postgraduates have to be thinking differently and doing differently, so that this imagination of new public health or the reimagined public health can become a reality. So while we are speaking that it is not a disease-oriented public health, we're speaking about the social purpose, the social equity, social justice as the core of this public health. We think about people who are not only experts in technocratic skills of research, computer skills, quantitative measure, which are important, But we are saying we also need contextualize these skills, why these skills are required and for whom. And that is that connects us to the social purpose of the public health. So we are thinking, we are saying the new cadre who will really be the the tools or mechanisms or the carriers or vehicles of realizing this dream have to have the balance of perspectives of skills, knowledge sets, and also it should be driven by key perspectives. The second important thing that we are speaking about, we are imagining, is that while knowledge and perspectives are important, the competencies are also at the core of the new public health cadre practitioners that we are imagining. What is the meaning of this now new the set of competencies? We are saying a MPH graduate should be able to deal with the community and its issues up to the level of a district level, running programs. So what that person can do in the communities, looking at assessing communities, the burden of diseases there, preparing a community health plan, what are the interventions that are required in the communities, from there to intervening with the primary health centers, or reimagining or designing new programs for the community, understanding the disease burden or health issues there, even up to the district level to manage a program. So we are really imagining not only some technocrats, but also people who have technical skills who can grow up as public health leaders, who can actually take charge and who can give, that kind of a direction to a large number of people to change this public health in the country. So that's why one of the key ingredients that we have got in this program that we're imagining is that it cannot be restricted to only a health science, that kind of a medical or a health science stream people. And it is a multidisciplinary subject, and we're opening it up to a large number of disciplines, humanities, pure sciences, others, who really are driven by the passion that something has to be done and public health has to be changed, and we need to drive this change. And to do all that, we are imagining this education to be embedded in practice. So practice and learning through practice is one important ingredient of our new program that we have designed. So we have generally seen that students go to the field, they observe, they come back. So field becomes, site of visit. But in our reimagination of public health education, we are saying field is as good as a classroom. Field is a site of learning. And that is where we soil our hands and feet, we dirty our hands, we understand what is there and how things can be, can be made, things can be made better. And that's why field practice and engaging with the field becomes an important component of this reimagined learning, reimagined pedagogies in creating these new leaders and public health cadre. We can open it up to more for discussion later, but I hand over to my colleague Mukta now, who will look at what are the different pedagogical, strategies that we have imagined in this MPH that we are going to offer in the Bhopal campus of our university.
Should I move to the next slide?
Yeah.
Next slide.
Yes, please. Am I audible?
Very clear.
Okay, audible. So good evening, everyone. So we are talking about reimagining public health. So in order to reimagine public health, what we also need to do is reimagine how we learn public health. And that is something we've been trying to do. As working in the field of public health is an art and a science, we also acknowledge that learning public health too is an art and a science. So we invest in developing new ways of teaching, creating different kinds of pedagogical tools, which are not restricted to the four walls of the classroom. You can see some pictures on this slide, which try to capture the essence of how we imagine developing a community of learners. My colleagues Arima and Edward, both of them have shared the importance of shaping perspectives, gaining theoretical knowledge, building competencies so that students, once they graduate, are able to work as public health leaders, public health practitioners. In order to ensure this, the teaching approach, the pedagogical approach of the program will promote active and collaborative learning. So there will be ample opportunities for the students to learn through, observations, class discussions, very interesting readings, which are also rooted in the Indian context, field-based journal writing, having one-on-one dialogue with some very grounded, experienced public health practitioners in India, along with close mentoring for each student to build their own interests and skills. In addition to this, we will also use some case stories, worksheets, watching some films together, developing different kinds of simulation games, student engagement with various activities, and along with that, having in-class debates, thematic labs, and you might have seen we also have some workshops, and one workshop which is already mentioned in the program is workshop on health communication. So you can also imagine that this is a rigorous program. Let's hear from my colleague, Professor Seema, about how graduating from this program will equip you to contribute to the field of public health. Seema, over to you.
Yeah, thank you, Mukta. A very good evening, everyone. As Mukta mentioned, I'm going to talk about the career opportunities for our MPH graduates. So we imagine our MPH graduates to work in a range of setups, including non-government organizations, ranging from mid to large level organizations, policy think tanks, public health consultancies, government technical and research institutes, wherein they can take up a range of roles, such as community engagement coordinators, skilled for mobilization, advocacy, for conducting health vulnerability assessments, for communications. They can take up positions such as program leads, program managers, requiring skills in design, monitoring and evaluation, implementation, team leads, or creating systems to understand specific health concerns. They can serve as intervention specialists, carrying out a range of interventions across sectors, research analysts, technical specialists, consultants, to a different government, to a range of government health programs, working in different kinds of setup. So these are some of the opportunities that we envisage for our MPH graduates among the pool of opportunities that are available for a competent public health cadre. So I will end here, and over to you, Rajgopal.
Thank you, Seema. Thank you all professors. In fact, I think I was in fact making my own notes, and this really helped the way you started and you kind of summarized that we are looking beyond techno-managerial solutions to solve problems of public health. Right? So what I'll do quickly is, before we take questions, I'll just end. Or should we take questions now, or do you think we wait till the end? I'm okay with both. If there are any pressing questions, I hope, since there is nothing on the chat, I'll move on, and we'll take questions towards the end. Let's do that. So the next is very quickly about, I mean, in case you're wondering what are the timelines that we're looking at. The good news is that Azim Premji University Bhopal is now in what we call it's gazetted, right? We're only waiting to invite applications for admissions, and we're looking at having the written examination. There'll be an entrance test sometime in the month of April. We are yet to decide the dates, and those who are shortlisted, I hope many of you would get shortlisted. So you'll be invited for an interview, and the interviews will be by our faculty members. There'll be more people. There's much more. There's a bigger team, and then the selection process is over. You will receive an offer letter from us, which will have all the details of, including your scholarships if you're eligible and things like that, right? The selection process, we'll send you anyway an email very soon. There are sample question papers on the website, and I would always suggest that please do not attempt the entrance test on the day of the examination. It's always good to practice. You may be working, you may be an expert in language comprehension or mathematical ability, but the practice will help you. And I'm not going through, that there is an MCQ section. We're trying to look at your basic readiness to blossom in a higher education program at Azim Premji University, right? I mean, I wouldn't say it's a It's a tough entrance test, but I would say that it is clearly checking your comprehension, mathematical ability. There's a writing skill session as well. And then, as I said, once you are shortlisted, you'll be called for an interview. I just saw there's a question on the eligibility that's coming on my next slide. And I would need the help of my colleagues, professors here to help me answer those questions. I can see a lot of messages on the chat, but I'll stop there on the next slide, which you can read, which is the key thing is that you should have 2 years of work experience at the time of joining. So I'm glad whoever wrote there to make it much more easier. If you have 1.5 years of experience as of now, that is also an eligibility, right? Or in other words, if you're graduating in 2023, you will not be able to apply to our MPH program, right? So see, we're not. I think I'm answering whatever the questions you are asking. It's getting answered here. So Tanmay, if your question is not answered, yeah, BSc,
yes, sir.
BSc then diploma, yeah, BSc then diploma. So you should have of course, to do higher education to get your second degree, you should have a valid first degree, right? So BSc is valid, but then if a diploma is not an eligibility because that may not count towards a work experience. So what are the process of doing PhD further? That I would let my expert colleagues to answer. Completed BSc honors anthropology. See, the thing is, Arima, do you want to answer that question? Somebody has done BSc honors in anthropology. Can I apply for this?
Yeah, sure. Absolutely. You know, as we are saying that you don't need a health sciences background, and which is it's a deliberate, and we are saying it. But what is important is that irrespective of your undergraduate disciplines, in whether it is biology or anthropology or anything, what is important is one of the important criteria is that you need 2 years of experience. And, you know, as we can see, experience, we are trying to little kind of broaden it. It's not necessarily has to be formal work experience, but, you know, somebody who, you know, has been a fellow, for example, you know, Gandhi fellow or Teach India fellow. Fellowship also counts for that. You can have substantial volunteering experience, that also counts for that. And for those who are from health sciences background, you have this clinical internship that can be counted towards also the experience. So anthropology honors is not a bar, but you have to have 2 years of experience.
Yeah, thank you.
Sorry, sir. I have to interrupt.
Who is this? Who's speaking?
Sir,
can you just introduce yourself?
My name is Tanmay Mandal from West Bengal. Sir, I have a question about 2-year work experience. Actually, I completed BSc, Bachelor in Science. After that, I completed diploma in pharmacy. Then now I'm pursuing PG diploma in sustainable rural reconstruction, and I completed 1 month internship in SARCH organization, Gadchiroli, Maharashtra. So for in 2-year diploma course and also 1 year PG diploma in sustainable rural reconstruction, and also my internship can counted with this experience, work experience. Can I apply for that?
That internship was part of your academic requirements, Tanmay?
Yes, ma'am.
Yeah, I mean, it would still be 1 year, right? So that's a bit of a,
yes.
Yeah.
What do you know? I think Sustainable Rural Reconstruction, Gandhi Research Foundation, Jalgaon.
Yes, there could be specific cases which we may not be able to really answer, you know, without looking into the next level of details. So Tanmay, you just write to us, and then we'll have to take a call on this, right? Because some of the, I mean, even if you say academic internship, we'll have to really look at, you know, what is the intensity in which the internship was done. I mean, when we say work experience, we are really looking at having worked in an organization on the ground, having got your hands dirty, right? So give us some time. It may not be a straightforward answers for us to. I'll just quickly answer Sambit's question. I know I can see 3 hands raised. Just give me 5 minutes. Sambit's question is: do we have to be a medical professional or someone associated with the healthcare? The clear answer is not at all. Of course, you're welcome, But Arima, you could add, you do, I mean, that's the point we're trying to make. We're not trying to look at this MPH program through the lens of medicine, and we want the sociologist in the classroom, we want the anthropologist in the classroom. So
Most of the
Yeah.
so Arima, could you just add to Sambit's question?
Yeah, no, just want to emphasize, Rajagopal has already said, I want to emphasize the point. You don't need a health science background to do Master of Public Health here. That's something that which you want to emphasize. So you don't have to. So that is not a problem. What is something that you need to keep in mind? I think there's one of the questions is that I'm graduating this year or have graduated, but I don't have work experience or any of the experience that we are talking about in terms of long-term internships or voluntary or whatever, then it's you will not be eligible. Yeah.
So what next I'm going to do is there are a lot of questions of when the exams form will be announced, which I'll answer in the next 10 minutes or so. But then there are 3 raised hands. So in the order, Winston, if, what's your question?
Yeah. Hi, good evening, everyone. I am Glorgio Winston, and I am currently working as a community coordinator in Assam. My question is, I have done BBA, but I've done in distance as I was not financially that stable to go to college at that time. So after I finished my distance BBA, I joined in healthcare sector as a volunteer, and slowly I have around 5 years of experience in one in hospital of 1 year and 4 years in community health. So currently I'm working as a community coordinator. But as I did my distance course in degree, like undergraduate, I was really worried whether I'll be able to apply for this course, because I've done BBA course, and after that, actually I started working in healthcare sector, and I really enjoyed working there and helping the community. So I was a little
quickly answer. See, Arima, others can add. See, what's written here is when we say graduate degree in any discipline, what we mean is that we really value your undergraduate degree. It doesn't matter. You might have done in management, you might have done in commerce, you might have done in sciences, right? And if it's a valid degree, it doesn't matter, distance or I think there are various reasons why people do distance. For example, for the undergraduate program here, NIOS, the National Institute of Open Schooling, is an eligible certificate to do the undergrad program here. The same way, if you have done the distance education from a university of standing, which is approved by the UGC and the Association of Indian Universities in India, we'll be happy to accept your degree, right? So if your degree is valid degree to pursue further studies in India, plus you have the work experience, you have actually more qualified with the work experience, you can apply, right? But all this validation of this and all we do only at the time of admission. Yeah. So
yes,
distance education, go for it. Can be IGNOU, I don't know from where you're done, but if it's a recognized university, that should not be a problem. Correct, Arima? Others, right? I don't think, yeah. That's standard across all the program. The key factor here is you have to listen carefully. What they're saying is you having worked for 2 years after your graduation.
Thank you so much.
Yeah. So I'll take quickly Shreya C. Day's question. I'm sorry if I'm not pronouncing the name correctly.
Good evening, sir and ma'am. I'm Shreya Day from West Bengal. I have completed my BSc nursing, and there I had to do 3 months internship in the field. And after that, I worked for 1.5 years, and then I'm also working now as a staff nurse in one of the government hospital. Now the fact is, and also I have worked 3 months under the National Health Mission as the community health officer. But the problem is, none of them have given me any certificate of experience. There is always the joining letter and the resignation letter, releasing letter, everything, but there is not any particular experience certificate. So will I be able to join your institution?
The thing is, see, it will be very difficult for us to answer individual queries like this, but we'll give a generic, broad this thing. First question, see, for anybody on the call, right? Thanks for asking that question. Anybody on this meeting? The first question to ask yourself is, when did you complete your graduation? Right? Is it 2020? Yeah, so that's in that first bar is cleared, right? So between 2020 graduation and 23, you have 3 years. Now the question that you're asking is, for the 3 years that I worked, I don't have appointment letter. Do you have appointment letter?
I have appointment letter, joining letter,
So
resignation letters.
Right. So all these things will at the next level, right? What you're saying is you may not have a certificate. How do I prove that I have worked for 2 years? That's the next level, right? At this point of time, I won't be able to solve it. We will figure it out. There'll be some way for you to say that, okay, if you worked, you got a salary in your account in the form of a stipend or a salary. I mean, hope that's not in cash. So that's all that are proof of employment, right? That you worked. And if nothing works, we'll take a self-attested certificate from you that you have worked in this organization, and we'll do the validation by giving references. We have done that. So don't worry too much about it. At this point of time, if somebody like you have done nursing and wanting to do public health, look at the program, find out that, make a very informed choice that this is the kind of program that you want to do in the next 2 years, right? Is it fine? Can we go to
Sir.
Vivek Kumar, scholar?
Hello.
Yeah, Vivek.
Hello, sir.
Who's speaking?
Sir, I am speaking Shaktivel. Speaking here.
Shaktivel, can you wait? I have others to answer. Vivek, Muskan, Suraj, Dr. Vikas. I'm going in that order.
Okay, sorry, sir. Sorry
No
for
problem, no problem. Vivek, can you unmute yourself and then ask a question? Vivek, can you hear me? We can't hear you. Do you have a question to ask? We can't hear you at all. I'm so sorry. Do you want to type that in the chat, and then we'll take it from there? Right? We'll come back to you. Muskan, what's the question? We'll come back to you, Vivek.
Good evening, sir.
Good evening. And if
Sir,
you can,
I'm pursuing right now. I'm pursuing BSc Honors Anthropology in Amity University, Noida.
right.
So, can I apply this MPH course? I don't have any work experience.
No. But can I just say something for your benefit, right?
Yeah.
I mean, we are so excited that you are interested in public health, wanting to do a degree in public health, having done anthropology. So great, having done a social science area. Somebody like you should really spend time doing. I'm sorry for giving an advice like this on this forum, but this for others also. And I do that when I meet young people like you. A good fellowship program of 2 years is what you should be doing. And then you are automatically eligible for a PG program in public health at Azim Premji University. And this is just, this is not for Muskan alone, for all other, because you have taken the first step of wanting to work in this sector, right? In the health sector. That itself is a great thing. So yeah, you are not eligible because you're just graduating now and with no work experience. Suraj, what's your question? Vivek, have you sorted your this thing? Otherwise, I'm going to Suraj.
Hello, sir.
Yeah, who's speaking? Yeah, Suraj.
Suraj is speaking, sir. Am I audible?
Yeah, very clear.
Sir, I'm a medical graduate and I have 1 year of clinical internship. Will that be counted as an experience?
That I need, I need my colleagues to really answer. How are we looking at MBBS, because it's 5 years, 1 year experience of clinical work. Are we looking at that?
No, that clinical internship is considered as work experience. I mean, field overall experience that we are counting.
Okay.
Yep.
Thank you, ma'am. Also, I have an experience of 1 year in a nursing home in one of the rural areas of Kerala. So I hope I'm eligible because I have a combined 2 years of experience.
Yes.
Thank you, ma'am. Also, my question is, I'm somebody who's passionate about administration in general and in particular about health administration. So that's why I chose to pursue. I'm preparing for civil services, and if God forbid, if something doesn't happen, work out, my next preference is to choose public health as my career option. What is the extent to which an administration, health administration is combined in a public health setup? And also, I would like to know a possible career graph that a public health professional can go on.
And I just brought this slide because, Arima, you can add, others can add, right? The entire administration or program management, what you're talking about is what is kind of summarized in this role called program lead/managers.
Thank you, sir.
Arima, do you want to add something?
Not really. If you are only looking at administration in terms of, say, hospital administration, that kind of a thing, maybe not. But if you're talking about more in terms of kind of leading programs, coordinating programs, managing programs, that kind of thing, definitely.
Yes, ma'am. I'm not at all interested in managing just an institution or something.
Okay,
I'm more interested in,
sure.
I mean, managing somewhat. We can make an holistic approach to the society and have a broader.
Yeah.
That's what it is meant. I'll just add to this for the others also. See, this is, I mean, I use the word administration. I would use the word program management. And when I say program to me is a social intervention that is designed either at a state level or at a community level, or it could be at a district level, or it could be some intervention designed by the organization itself, right? Now, to lead those things, I mean, it will be great to see people who are public health professionals leading that, rather than MBA holders doing it. I have nothing against MBA, but don't get me wrong. But the thing is, I mean, there's no techno-managerial solution. So yeah, so you will, and the career graph is going to be something like this. I'm not talking about the health sector per se. Give a very, very, very broad. See, when you start working, right? When you start working, you may be working at a block level to understand what's really going on. Then with your experience, you've done very well. Then probably you'll be taking care of multiple blocks.
Okay.
Then at a district level, right? Then you may be designing, when you with experience, you may be designing interventions for various districts. So that's how a clear. Of course, you may not have fancy terms like a president, vice president, and things like that. I'm more from the corporate to the space, so I kind of compare the corporate sector and the social sector. But the career graph is going to be something starting at a block level, and you may be designing intervention at a national level. So,
sir, I would like to add on.
Stop now. Yeah, sorry.
Sir, since it's the first course, and I mean, comparatively, I mean, the campus is new, I think, in Bhopal, AP University in Bhopal. So, what will be the recruiting opportunities that we'll be getting?
So, I just see. Thank you for asking. I never planned to cover this. I mean, this is we are more than a decade old. We started in 2011.
Yes.
Right. So, and it is with this backing off, this experience is what has given us motivation to start this program. Correct. And public health for us is not new. We have been teaching all these courses, distributed as part of the other PG programs that we have. And right. So the point I'm trying to make is we have a very solid placement cell.
Okay.
And you won't believe, I mean, I didn't want to say this in a public forum like this, but let me still say this. We are having to say no to organization for recruitment for this year because we have got a very long list. Right. So once this start with this team, when they start activating their Bhopal channel, we'll have the same scenario, right?
Okay, thank you. Thank you very much.
Do not, I mean, how do I say this? I mean, we don't try to lure people into the university by telling there is placement. We never do that, right? Okay. But let me put it this way: if you apply yourself well, if you read well, if you write well, engage well, there are jobs waiting for you, right?
Thank you, sir. Thank you very much.
Thank you. I know there are chat messages coming. We'll take all that. I don't know. My colleague Satyajit is also on the call. So if you could just quickly respond to some of the queries using the reply option, that will be great. And I'll take, I'm sorry, I'm not getting the name clearly here on my Zoom, Madhusmita Devi's question. Vivek, we'll come back to you. We lost you, but Vivek, we'll take your question later. Yeah.
Okay, sir. Thank you.
Yeah, good evening, sir. It was very insightful orientation. So I wanted to know, I'm doing my sociology honors, third year, last semester this time. So what kind of work experience does it count? Like I have been working on a startup and I have been a part of some startup, but it's just startup. So is it limited to some social work organization or any kind of,
Arima, you want to take that?
What
Good evening, sir.
Can you just tell us a little bit about what is the kind of work that you are doing with the startup? What does it mean? What startups?
Yeah, so in COVID, we had started online delivery like Zepto and Blinkit in our small town in Assam. And that we worked that I worked on for around 6 months. And now I have a small startup in Assam where there are I have 2 girls who I have employed, and we have this small startup where we make handmade jewelries. So it's a kind of not exact, like I have 2 interns, so it's like they get supported by what I do. And yeah, it's kind of a startup. I've been doing that for 2 years now. So does that count? And if I'm eligible to join this time, I just wanted to know that. Yeah, thank you.
Okay. Well, I mean, what we meant by this work experience is a very broadly kind of a social sector, that kind of a work experience, right? That's what we meant, Madhusmita. But for anything, something very specific, as Rajagopal is saying, perhaps one-on-one, you can kind of check with the right to Satyajit and just figure it out a little more about this. Okay? Yeah.
Yeah.
Good evening, sir.
Who's asking? Is it Faizan?
Yes.
Yeah, go ahead. I'll answer I'll add to what Arima said later on the experience. What is the kind of experience we're looking at?
Yeah.
But Faizan, what's your question? Then I want to go to a lot of chat messages. I need to go there and then look at.
Okay, all right, sir. Sir, actually, I'm Faizan Abdul Sufi. I'm from Kashmir. My question is very basic. It's regarding when will be the dates out?
Yeah. Okay.
Course, because we are eagerly waiting.
Yeah. So let me put it this way. I think many people are asking that. It will be very soon, as soon as in the next 8 to 10 days, right? That's what we're looking at. And we'll be inviting applications. Most of you have registered, right? So you'll get an email from us.
Okay.
If you have left your details, do not worry. You'll get an email from us stating that now you can register for admission. That is basically you're registering for the admission test, right? And then as soon as we have that process over, in the next 15-20 days, we would have the date decided. You'll get the admit card for the entrance test. You have to pay for the entrance test. Just give us, it'll be next week. And we should know that we have Azim Premji University, Bangalore also. As soon as we're going to close admissions here, we'll be opening applications for Bhopal also. Right?
Thank you, sir.
Thank you so much. And which
Can
part
I ask, sir?
Yeah, so if you want to ask a question, just raise your hand. But before that, I think if you have not responded to, is there any of the chat messages that I should respond, Satyajit? And thank you.
Yes, sir. Can I comment?
Just 1 second. I'll just ask, is there anything on the chat that I should be answering, Arima, I should be answering, Satyajit, Aditya?
Yeah, I think you're going pretty much on track. Only issue is, I think Vivek's question might be pertinent. He comes with a lot of work experience, so he'd like to probably ask about the program and whether it is relevant to the kind of experience that he has.
Thank you. So I think we're doing pretty well on time and also really enjoying the questions. Yeah, somebody was saying something. I think I interrupted him or her.
Yes, sir, myself.
Yeah, go for it.
Dr. Vikas Malviya here.
Yes, doctor.
Good evening, all and sundry. It was really nice being here. And first of all, I'd like to introduce myself, Dr. Vikas Malviya. And I have 6 years of working experience and presently working as Deputy Director of Hospital Administration at Pedagogical Health Services Government of Madhya Pradesh.
Right.
So I have just one simple question, that since I'm a full-time working professional, working at the state secretary, so I'm good to go to the course. I'm going to the website, then you have certain flexibilities in the course for enabling the working professional to be a part of this, because unfortunately I'll not be able to be a part of the classrooms on a regular basis.
Yeah. So at this point of time, we do not have a flexibility because this is designed as a 2-year full-time postgraduate degree program, right? And that means that you will have to attend classes, right? So at this point, will we not have some kind of a blended mode program later? We'll have to see. I mean, I don't want to be making a forward-looking statement at this point of time. So just to give you a background, this is how we started. We have a 2-year full-time education and development programs, 2-year full-time PG programs. And over the years, we realized that we need to offer blended mode PG diploma programs for practicing professionals. And we have started recently diploma programs in that sense, right? But today, since you're asking, we are in February 2023. The only program that we will have focused on public health will be MPH, two-year MPH. So I mean, I understand you may not be able to get sabbatical and things like that, but there are people who had taken 2-year sabbatical. People who were working in the armed forces or as in the education department, they took 2-year sabbatical for various things, not only for that academic gyan, which they it's for using the library, building a network of professionals, right? So that's something that is important studying at a university. The network that you build, both your teachers and your colleagues, your classmates. So yeah, so that's my response, Dr. Vikas. Yeah.
That's really fine, sir. What you said is all taken because ultimately, if you're a classroom student and if you're going to pursue a course like MPH, I think so that you should be a part of classroom. But unfortunately, now being a full-time working professional, I don't have that.
Fully understand. Fully understand. Because see, the thing here, when this is a,
I'll take 2 more minutes, a minute or two. Actually, when I was going to the website, that was the reason that I visited the Bhopal campus today itself, because I'm residing here at Bhopal. Working here, I'm residing here. I went to the campus so as to be in touch with the academic councils and all to just get this particular thing clear. Website page was showing that APU has course for the work professionals as well, where they have sort of an attachment period per semester, and all. Likewise, the other universities who are providing this MPH course are also doing.
Your voice is breaking for me for some reason. I'm not sure whether my other colleagues are able to hear you clearly.
No, it's breaking for us as well.
Yeah. Could you repeat what you said? You said you went to the campus.
Yeah, I went to the campus
whom
just
did
to
you
look
meet
whether
there?
Do we have any. No, actually, I was not able to meet any of the personnel out there, but I got a contact number of the concerned, so I'll be in touch with the person. But when I went to the website, if I'm not mistaken, what I saw was written that this course is for working professionals as well, and they can get enrolled.
Well, yeah, wait a minute. We would not have written it explicitly. Of course, it is designed for people with work experience, but they need to take either a sabbatical or a break from their work and then join the program.
Okay, fine. Then I'll be in touch and I'll see in due course something happens. I'll be
Sure.
glad to be a part of APU, because ultimately we have arrangements here also to go for pursuing these courses.
Yeah.
In between our careers as a sponsored candidates, but doing this course from reputed university like APU. Anyway, thanks a lot for your insightful information.
Thank you.
In touch later on.
Yeah, so thank you for your kind words also. Yes, Vivek, over to you.
Thank you, sir. Am I audible now?
Very clear, very clear, very clear.
Thanks, sir, for organizing such a good webinar. My name is Vivek and I am 43 years old. I am from Muzaffarpur, Bihar. Sir, I graduated in 2005 at my age of 25 years. And since then, I am working in many organizations, mostly in health research project. So, sir, I have more than 10 years experience in health research project on different designation. Like I started my job from field worker, then project secretary cum data manager, and currently as a project manager. I have a family to take care of, and because my project in which I am working, actually it is externally funded project, and funding is soon to going to be in. So I was thinking to do a regular course, but I'm wondering if at this age of 43, is it suitable for me to do a classroom such type of thing? Because 18 years have passed, and since my regular class.
Yeah.
And the second thing is that I have family responsibility and all those things. So after completing MPH from APU, will I be able to get a good job so that
so Vivek, yeah. No, I can fully understand what you're saying. Probably I was also on that side. Of course, a lot of difference a couple of years back. This requires a much more detailed discussion. Okay, so Satyajit and I will probably get in touch with you. But broadly, let me give you some inputs, and this for others on the call also. Based on what we have seen in the last 12 years at Azim Premji University. If you had asked me this question in 2014, when we had just started, we may not have had a lot of examples. But now we can say that there are people like you with work experience who have come, joined, and done extremely well in the program. Right? They've done extremely well. Man, my college senior studied here. So I was shocked. I thought he came to, enroll his son or daughter. Then Sanjeet said, no, I'm going to join here. I'm going to study for 2 years, because he sees another 25 years of work life in him, and understood the importance of academic frameworks. Because you may be a practitioner on the ground working in the sector, but you need to connect those dots, right? Which approach should I take? Should I take so in that way, do not even doubt yourself, but you should be somebody who is in the habit of reading. Then this program is for you.
Sir, after completing my graduation, I did a master in economics, master in social work, and MBA, and lots of things, everything from distance working. So I think the student in me is alive, but I am afraid.
Yeah, no, that's what. So this fear in you, we'll have to have a longer discussion with you and then do it, right?
Okay, sir.
So when we discuss, we'll talk about the financial assistance, which we talk about in a very humble manner, but we're quite proud about how we provide access to higher education, in a country like India. So we'll talk about the financial assistance schemes and things like that when we discussed. But I would say that you should go through the selection process, and please leave the rest to us at this point of time. At this point of time, just focus. You have heard the faculty members. You know what kind of program this is. Spend some time looking at the website, right?
Okay, sir.
And thank you to my colleagues who are handling the chat messages, so that I don't have to go through that. Yes, so Dr. Ankush Kumar, over to you, sir.
Sir, good evening.
Good evening.
Sir, myself, Dr. Ankush Kumar Gonde. I would like to know, sir, when we are going to start the admission process for examination.
Yeah. So the thing is, we're waiting for a couple of days more. It will definitely not be March. Couple of days more in February, because we got the Azim Premji University Bhopal is in the official records of the Madhya Pradesh state government. So we'll be inviting the registration for admissions very soon, right? If you will get an email from us, because I'm sure you're already pre-registered. So you'll get an email.
Yes, sir. I have done registration.
Yeah.
And so, I am in contact with Satya, sir.
Yeah, great. So you will be receiving it very soon. So at this point of time, I would just tell all the participants to, I know I'm repeating what I said, is to prepare for the entrance test, which may look seemingly simple. Seemingly easy. There are some sample question papers on the website, but some kind of a preparation will really help you. Okay. There was somebody who was asking, I forgot the name, Shaktivel or somebody whom I stopped. If he's on the call, he can ask the question. Otherwise, I'm going to Tanmay Mandal.
I think Aditya responded to his question.
I responded to his question. Okay.
Aditya, is that correct?
I answered one question. Let me check if he had others.
Okay, because I remember he asked the question twice. Yeah.
No, Shaktivel's question has been answered.
Yeah. So, Tanmay, you have a question? I'll just summarize if you have any more.
Yes, sir. And so most of the students have a question about your eligible criteria. So if you share the MPH department email ID, and we are sharing our CV and also cover letter, then after seeing that if you share your eligibility, we are eligible or not, then it is very fruitful for us.
Yeah. So you can address it to somebody's voice is breaking. I need to mute all, or sorry, Just some background noise. I had to mute everyone. We heard you, Tanmay. We heard you. If you want to, if
Here voice
Sorry, sir.
properly.
Sorry, sir.
no, Tanmay, we could hear you. If you want to email, reach Satyajit or me or the professors, write an email to outreach. Okay. Whatever you want.
Okay, sir.
Right? outreach@apu.edu.in. One of my colleagues would respond. Yeah.
MPH colleague. Okay, sir.
Yeah.
Okay, sir.
Yeah.
Actually, sir, my WhatsApp page.
Yeah, those who want to reach out to us, because it's quite, how do I say this? We're quite keen to interact with you over the next couple of months, because you're so interested. You come this far. So if you think that we should be calling you back for a detailed discussion, drop us an email with your details. But give us some time. We'll kind of schedule a call back. Either me or Satyajit or one of us would give you a call back with it. And this is not the first webinar, right? This is first among the many webinars that we will do for you. Okay, let me say that with a lot of confidence. This is the first among the many webinars that we will do, because very quite nicely, they did not put the program structure, how the 4 semesters looks like and things like that. So slowly we will give you information, right? So one at a time. This was the idea was that if you ask me to I'm not summarizing, we could take a couple more questions. The idea was that we wanted to have an interaction with you, right? We've been only doing through emails. And the faculty members were in fact after us to set up this webinar. So as part of the outreach team, we did that. And so that's part one. Part two, we want to tell you about the brief eligibility. There were a lot of emails that we were getting on the eligibility process. So we hope we've been able to clarify that. Second, we want to tell you about the selection process. So that was the idea. Any other questions? We are well on time. Should we the questions are not answered, we can stay. Otherwise, should we wrap? What do you think?
Rajgopal, it would help if we talked a little about the scholarship and the fee waiver for.
Oh, right. Completely forgot about this. I was just thinking that there is something that I missed. Thank you, Satyajit. I'll just bring that slide up. But before I talk about that, let me give you a quick background about Azim Premji University. Yeah, I'm sure some of you may be familiar with the university. So quickly, right? So this university is established by the Azim Premji Foundation, right? And Professor Edward did cover that briefly about the why we established the university, with clearly to prepare a professional to solve the problems of the here and now of the country, right? That's the idea. So we were quite clear that whatever we do as a university, let it be degree, let it be diploma programs, the publication that comes out of Azim Premji University, the research that we do should all contribute in one form or the other to reduce the gap that we see in society, right? That part. Now, for that kind of a university, we were quite clear that access to higher education, to whoever wants to access higher education, we should make that possible, right? And there are various methods, various things that we do for that to happen, right? That's in terms of outreach. We travel to different parts of the country so that the information reaches different parts of India, right? Other thing that we do is need-based scholarship, right? This is not merit scholarship. Need-based scholarship is based on your family income. So that's part one of it. So if your family income is going to be 7 lakhs, less than 7 lakhs, you are eligible for scholarships to study the PG program at Azim Premji University. I'm not going to read into the full details. Yeah, this is important. If it happens that your family income is less than 2 lakhs, it is full fee waiver is what we call, right? The tuition fee is waived off. And what many people miss out is we have need-based scholarship in the accommodation also. It is not only on tuition, it's on tuition, it's on accommodation. Exception cases, we waive off the charges for food also, right? So that's also there. All the food payment, they written with actuals. In some cases, COVID has taught us a lot, right? COVID has really exposed the vulnerability of families in India. So that's briefly about it. Now, apart from all this, what we realize is there are many of them who have been working like 5 years. Of course, Vivek's case is slightly different. He's been working for quite some time. They might have worked for 3-4 years, 4-5 years. You know, they're stopping or they're leaving the job and joining Azim Premji University. We waive off their 1 year's tuition fee, right? 1 year tuition fee waiver. Other form, I mean, what we've written is 50% tuition fee waiver. So broadly, that's the thing. I would say that do not worry about finances at this point of time. Leave it to us. Give us some time to talk to you. There's something called a financial assistance discussion that will happen post the interviews, and that we do it very, very seriously. My expert colleagues would get in touch with you. We get your documents. We try to find out, and then we decide whether the student needs full waiver, partial waiver, and things like that. So it's a pretty robust process, which we kind of, I mean, I don't want to say we've got it right. We're learning, but we do pretty well in the last 10 years. I think we've done pretty well. Okay, so that's thank you, Satyajit, for reminding. And
there's another question from Rachna, who wants to know what the 4 semesters will look like.
So go and look at the website, right? It's pretty well explained, but you know, I don't know. Anybody wants to take that question?
The brochure has a lot of details.
Right. So Satyajit, is it possible for you to pull up the slide? I mean, it's very easy. I like the URL also. Azim Premji University edu.in/MPH. So if you go to your browser and type Azim Premji University edu.in/MPH, you'll get that, and then and that's very well written. When I was reading 2-3 days back, where you made the case for public health professionals, and the brochure. Thank you very much. Thanks for reminding. The brochure has how the 4 semester will look like, and what will be surprising for you is the time for field practice. Very carefully designed 4 semester program. So Kathy, employment opportunities, we briefly touched upon. The variety of, it's not like, clearly it's not preparing you for a role or a track. You decide what you want to do, or you may start off as at one area and then become, and then you move into other areas. So it's not a single track journey that we have looked at. And the same cohort, depending on your interest, your experience you bring in, you'll branch out into various roles, and these are the needs of the public health sector. And I'm not a public health expert in that sense, but people have worked on the ground. The practitioners would know that. Okay, Kathy, there is a recording of this. If you need it, I mean, we will just drop us an email. We'll send you the recording. Yeah, Nabanita, go for it.
Hello, good evening to the panel. Am I audible?
Yes, it's very clear.
Okay. So what I would want to know is, number one, the internship, I mean, it is applicable to all the programs, I guess. This is a generic question, not specific to this particular field. The internships, whatever is provided from the Azim Premji institution. Okay. I just wanted to know, is it mandatory for the candidate to go ahead with those internship only, or if the candidate is capable enough to organize his or her own internship, they can go ahead with those with the prior approval of the institution?
Will I respond, Rajagopal?
Please.
Yeah. Navanita, let me talk about MPH, the way that this is designed, this internship. The internship combined with the field project, that's basically the character of this particular field placement, field engagement. The entire semester is in an organizational setup, right? So the idea is to be able to pick up skills in organizational practice, as well as to get deeper into something and to hone your skills in trying to do something independently. That's how it is imagined. Now, for something like this, where entire semester is actually spent, right? So we are trying to plan it even 1 year before, right? So that means the planning has to be done, the students' interests, what the organization is trying to say, what the faculty mentor, right? So a lot of preparation in terms of to figure out that the student's interest is mental health, for example, right? And we have, say, for example, 20 partners total for whatever number of students. Then, kind of discussing, saying, okay, so I think I'm more inclined towards this kind of organization because this is, doing work on this. Okay, so let's figure out whether there's a fitment with the organization, with faculty mentor. There's a lot of planning that is going to be taking place before we say that, okay, the student is going to be placed here, right? So it's not saying that, okay, so you go here, you go there. It's not going to be like that, right? It's a lot of this is three-way consultative process that's going to happen for this entire semester to be meaningful in that sense. Okay, so that's how it is imagined.
Thank you. Thank you so much.
Thank you very much. Thank you, Nabanita, for that question. So should we then wrap up?
Yeah, good discussion. Yes.
Yeah.
Now, we also know what needs to be updated on the website. So I've also made my notes. So a lot of this frequently asked questions. I think. Thank you very much for those who joined the session. Thank you to my colleagues who found time. So I think this is giving us a lot of hope, right? That there is interest in public health, and we will surely see improvement in the public health space in the country. So as I said, this is first among the many webinars that we do. Please do keeping watch out for the emails that will come out from Azim Premji University, and of course the first email that you will get will be please register for the admission test, and then we'll take it from there. Okay. So, and with that, it's goodbye from us for now until we meet again. Thank you.
Thank you, everyone.
Thank you.
Thank you. Bye.
Bye.
Thank you, sir.
Yeah, I'm just hanging around in case somebody wants to read the chat messages. If you have not looked at it, I'll just be here for 2-3 minutes for you to go through the chat messages. Okay, then I'll end the meeting by 6:23. I'll end the meeting. Shaktivel, the meeting has ended. I've muted all, and you will not be unmute yourself. I am just hanging around for the next 2 minutes. If you want to go through the chat messages and look at the responses that the faculty members have given. Okay, that's why it is. If you have a question, you can type in. But I'm going to end the meeting exactly at 6:24. Shaktivel, the meeting has ended. I've muted all.